Can you delay Medicare enrollment if you work past 65? Imagine being able to keep your current health coverage without rushing to sign up for Medicare right at age 65. Sounds appealing, right? Well, the good news is that if you are still working past 65 and have employer health insurance, you might be able to delay enrolling in Medicare. This is especially true if your employer has at least 20 full-time employees. When your employer provides health coverage that meets or exceeds Medicare standards, it is called creditable coverage. As long as you are actively employed and covered by this plan, you can postpone enrolling in Medicare Parts A, B, C, and D without facing penalties. If you or your spouse are working for a large employer and have this coverage, you can wait until you retire or your employment ends to sign up for Medicare. When that happens, you qualify for a special enrollment period. This period lasts for 8 months starting the month after your employment or coverage ends. During this time, you can enroll in Medicare without penalties. However, if you work for a smaller employer with fewer than 20 employees, Medicare usually becomes your primary health insurer at age 65. In this case, it's best to enroll when you're first eligible to avoid gaps in coverage or penalties. Also, if you have coverage through programs like COBRA or TRICARE, you might need to enroll in Medicare at age 65 because these plans are not considered creditable coverage in the same way employer plans are. Medicare Part A, which covers hospital stays, is usually free if you have paid enough Social Security taxes. It often starts automatically at age 65 if you are receiving Social Security benefits. But you can choose to delay enrolling in Part B and other parts if your employer coverage is sufficient. Just remember, once you enroll in Medicare, you cannot cancel Part A if it is premium-free. Also, enrolling in Medicare can affect your health savings account contributions, which must stop 6 months before you sign up. In practical terms, if you plan to keep working past 65 and your employer provides health insurance, it's generally better to stay on that plan and delay Medicare. When you finally retire or lose your employer coverage, you can then enroll during the special enrollment period. This way, you avoid paying unnecessary Medicare premiums and keep your coverage seamless. Managing your enrollment this way helps keep your out-of-pocket costs lower and ensures your health coverage matches your employment status.